Hello, I'm Dr. Obey Chopda, and today we're exploring a revolutionary advancement in modern surgery, the Da Vinci surgical system. As someone who has witnessed the evolution of surgical practices firsthand, I can tell you that this technology represents one of the most significant leaps forward in our field. The journey of surgical innovation is fascinating. From the earliest surgical tools to today's advanced technologies, our goal has always remained the same: to provide the best possible care with the least trauma to patients. Think of how we've moved from navigation by stars to GPS. Surgery has made a similar quantum leap in precision and capability. Before we delve into the specifics of the Da Vinci system, let's understand why robotic assistance in surgery marks such a pivotal moment. In traditional surgery, even the steadiest human hands have natural limitations. Even the most experienced surgeons face challenges with intricate procedures in tight spaces. The Da Vinci system addresses these fundamental challenges while enhancing our natural surgical abilities. The system's name pays homage to Leonardo da Vinci, who was not only a brilliant artist, but also a remarkable anatomist and inventor. His detailed anatomical drawings and mechanical innovations laid the groundwork for understanding human anatomy and designing complex machines. This fusion of art, science, and innovation perfectly embodies what the Da Vinci surgical system represents. The impact of this technology extends beyond just technical advancement. It's about reimagining what's possible in surgery, about pushing the boundaries of precision and control. Throughout today's discussion, we'll explore how this system is transforming surgical procedures, improving patient outcomes, and shaping the future of medical care. As one of my colleagues aptly put it, it's like giving surgeons superhuman abilities, minus the cape and tights. But in all seriousness, the capabilities this system provides are truly remarkable, and I'm excited to share them with you today. Let's explore the evolution that led us to robotic surgery. Traditional open surgery, while effective, has inherent limitations. Picture writing with a regular pencil versus having a precision tool that can automatically steady your hand. That's the kind of advancement we're discussing. The introduction of laparoscopic surgery marked our first major step toward minimally invasive procedures. Using specialized instruments through small incisions, surgeons could perform operations with less tissue trauma. However, these techniques presented their own challenges. The instruments moved in counterintuitive ways, visualization was limited to 2D screens, and surgeons had to maintain awkward positions for long periods. What many don't realize is the physical demands traditional surgery places on surgeons. Standing for hours, maintaining precise control, and working through limited access points, all while keeping perfectly steady hands. It's like trying to paint a masterpiece while doing a plank exercise, challenging even for the most skilled professional. The development of surgical assistance systems wasn't just about making procedures easier for surgeons. It was about expanding what's possible in surgery. Each advancement brought new capabilities: better visualization of surgical sites, enhanced instrument control, improved ergonomics for surgical teams, more precise tissue manipulation. These improvements emerged from understanding real surgical challenges. When surgeons needed better visibility, technology provided 3D visualization. When precise movements were crucial, systems offered scaled motion control. Each solution addressed specific needs in the operating room. The transition to robotic assistance represents a natural progression in this evolution. It combines the best aspects of traditional surgical skills with enhanced technological capabilities. This isn't about replacing surgical expertise, it's about augmenting it. Now, let's examine what makes the Da Vinci system truly revolutionary. At its core, the system consists of three main components working in perfect harmony: the surgeon's control console, the patient-side cart with robotic arms, and the advanced vision system. The surgeon's console is where the magic begins. Here, surgeons sit comfortably while viewing a perfect 3D high-definition image of the surgical site. The controls translate the surgeon's hand movements with incredible precision. One surgeon described it as having the world's most sophisticated gaming setup, except what you're controlling is precision surgical instruments. The robotic arms represent an engineering marvel. They can rotate 360 degrees and bend in ways that human wrists simply can't. Each instrument is designed for specific surgical tasks, from gentle tissue manipulation to precise suturing. The system scales the surgeon's movements, eliminating natural hand tremors and enabling unprecedented precision. Let's break down how this actually works during surgery. The surgeon views a magnified 3D image of the surgical site. Their hand movements are digitally translated to the robotic instruments. The system provides real-time feedback. Every movement is precisely controlled and scaled. The arms can reach areas difficult to access with traditional methods. The vision system provides up to 10x magnification, but it's more than just magnification. It offers perfect illumination, stable imaging, and crucial depth perception. This enhanced visualization means surgeons can see subtle tissue variations and tiny blood vessels that might be missed with traditional techniques. From years of surgical experience, I can tell you that the transition to robotic surgery represents both a challenge and an opportunity. When surgeons first encounter the Da Vinci system, there's a natural learning curve. It's like learning to write with your dominant hand again, except this time, you're writing with superhuman precision. The learning process is comprehensive and systematic. Surgeons begin with simulation training, progress to simple procedures, and gradually advance to more complex operations. This methodical approach ensures both safety and competency. The interesting part is how quickly surgeons adapt to the enhanced capabilities. What truly impresses experienced surgeons is the system's ability to expand surgical possibilities. Procedures that were once extremely challenging become more manageable. The precision and control allow for new approaches to complex anatomical areas. Let me share something that regularly amazes surgical teams: the ability to perform intricate suturing in tight spaces. With traditional methods, this can be extremely challenging. The Da Vinci system's precise control and 3D visualization make these tasks remarkably manageable.
The surgical community has documented several key advantages. Significantly reduced physical fatigue during long procedures. Enhanced ability to perform complex maneuvers. Better visualization of anatomical structures. Increased confidence in challenging cases. Improved ergonomics leading to better surgeon
longevity. One of the most significant benefits is the reduction in physical strain. Traditional surgery often requires maintaining awkward positions for hours. With the Da Vinci system, surgeons sit comfortably at the console, reducing fatigue and potentially extending their surgical careers. The system also enables better teaching and mentoring opportunities. Senior surgeons can guide trainees more effectively, using the same view of the surgical field and even taking control when needed. This has transformed how we train the next generation of surgeons. Let's explore the real-world impact of the Da Vinci system on surgical outcomes. The advantages we're seeing are significant and measurable. In my experience, the most notable improvements are in precision, recovery time, and overall patient satisfaction. The system allows for remarkably precise tissue handling. With traditional surgery, even experienced surgeons are limited by natural human hand tremors. The Da Vinci system eliminates this limitation entirely. Every movement is perfectly scaled and steadied, allowing for exceptional accuracy in delicate procedures. For patients, the benefits are substantial. Significantly smaller incisions. reduced post-operative pain, minimal scarring, shorter hospital stays, faster return to normal activities, lower risk of complications, reduced blood loss during surgery, better cosmetic outcomes. One patient remarked that finding their tiny incisions was like playing a game of spot the difference, they were that minimal. The impact on hospital stays is particularly noteworthy. Procedures that once required a week in the hospital often now see patients returning home in just a day or two. This isn't just about convenience. Shorter hospital stays generally mean lower risk of hospital-acquired infections and faster overall recovery. The precision of the system also means less trauma to surrounding tissues. Think of the difference between using a precise tool versus a broader one. The Da Vinci system allows for extremely targeted movements, minimizing impact on nearby structures. Let's tackle some common questions and concerns about robotic surgery head-on. The first is often about cost. Yes, the initial investment in a Da Vinci system is substantial. However, when we consider improved outcomes, shorter hospital stays, and faster patient recovery, the value becomes evident. Safety is another crucial consideration. The system has multiple redundant safety features built in. It's like having a backup for your backup, and then a backup for that backup. Every movement is precisely controlled by the surgeon, and the system includes safety measures that prevent any unintended actions. Some wonder about the learning curve for surgeons. The training process is comprehensive. Extensive simulator practice, supervised training cases, gradual progression to more complex procedures, regular skill assessments, ongoing professional development. Another frequent question concerns surgical control. Let me be clear, the robot doesn't perform the surgery independently. Every movement, every action is directly controlled by the surgeon at the console. The robot is an extension of the surgeon's own hands and mind, designed to make them more effective and precise. In conclusion, the Da Vinci surgical system represents the future of surgery. By combining advanced robotic technology with the skill and expertise of surgeons, we're able to achieve previously unimaginable precision and better outcomes for our patients. As technology continues to advance, we're entering an exciting era in surgery where precision, patient recovery, and overall healthcare outcomes will continue to improve. The future of surgery is here, and the Da Vinci system is leading the way. Stories like this are why I'm passionate about technology in healthcare and why I co-founded 𝐒𝐴𝐧𝐧𝐞𝐜. Our mission is simple but ambitious, to make innovations like the Da Vinci surgical system accessible to more people. At 𝐒𝐴𝐧𝐴𝐧𝐞𝐜, we're not just integrating advanced tools into healthcare, we're building a network of clinics that combine cutting-edge technology with compassionate care. From equipping surgeons with AI-driven solutions to offering faster, patient-focused services, we're redefining what's possible. Thank you for joining me today in exploring this incredible technology, and I look forward to sharing more insights with you in the future.